Hello class, this is Laura LaBeouf, and I'm here to talk about the Healthcare Affordability Act. The Healthcare Affordability Act, or H.R. 3962, as the Senate likes to call it, was passed in 2009. It was upheld as constitutional by the Supreme Court this year in 2012, and it goes into effect in 2013. So what does this mean for small employers and their staff? A lot of confusion. The bill's parameters keep changing monthly. And I know this because I am part of a group called the Society of HR Management, and I get updates every month. And the parameters of the bill change with the wind, as we like to say on Capitol Hill. I'm going to use my company as an example. This act directly affects small businesses, and I work for a small business out in Fairfax County. I manage an optometry office, and I have 18 staff. We provide health care through a large insurance company, Blue Cross Blue Shield. We pay 55% of the premium, and our staff pays 45%. So the Affordability Healthcare Act has eliminated pre-existing conditions. That is in effect now, as well as unlimited lifetime maximums. So what that means is if you have a staff member, let's say who has a chronic disease, they cannot be denied coverage for that disease, and it doesn't matter how much it costs, there are no lifetime maximums. It used to be $1 million, and now it isn't. And the reason that's important is that will affect your premiums upon renewal every year. So due to these changes, my premiums for this year went up 7% for my staff, and my broker is stating that will go up again next year, 7 to 15%. So what that means is I currently pay $3,080 per month for covering my staff, and I only cover 50% of them, so 9 people. This means that next year I'm looking at an increase annually of $2,580 up to $5,544. And that is a lot of money for a small company when we don't have a lot of cushion to begin with. So that's something we have to put into our budget, which means it's going to affect our rates as far as being a provider to the community. It also means for my staff that they can be paying an additional, individually, $373 to $504 each per year. It creates hardship for them and for us as well. So one good thing that the Act is trying to mandate in 2013 are insurance exchanges. And those are supposed to be done per state, Commonwealth of Virginia included. This would mean that I, as an employer, could go from cross state lines and try and get more comprehensive coverage at a cheaper cost. Unfortunately, many states have decided that this is not cost effective for them, and they're not doing them. Instead, they're extending what they already have through Medicaid, and that's what the Commonwealth is doing as well. That coverage is not as comprehensive as the one that I currently have for my staff. I have 3 different plans. I have an indemnity plan, a point of service plan, and an HMO. And I also have health savings accounts for them as well. So they have a very rich coverage. They have very low co-pays or none at all. And well visits and exams are covered at 100%. That would not be the same with Medicaid. So, and I believe it's going to be difficult to find any plan with that type of coverage to compare apples to apples. So starting in 2014, basically 1 year from now, if one of my staff decides to go with a state plan, because they will be allowed to do that, I as an employer will be penalized and have to pay $250 per month for that one staff person to the government. That's one way that they are affording this Healthcare Act. And just so you know, in 2013, if you make $200,000 for single, $250,000 for married, your Medicare tax is going to increase by 3.8%. And that's also help fund the act. So back to what I was saying, if I was not offering healthcare coverage for my staff at all, I would only have to pay $166 a month in penalties. So it makes more sense for me as an employer to not offer healthcare to my staff and just pay the penalty. I would save $1,100 a year and not have to worry about premiums going up. So I've read a good deal about the Healthcare Act, and I feel the premise behind it had good intentions. However, decisions are being made politically. It's being negatively skewed and turning to something that will not be a good thing for employers or for their staff. Thanks for listening.